Good morning, everyone. Thanks for joining me today. Today, I'm going to be talking about a topic that I've been really passionate about for maybe about the last 6 months or so, and that's concussion management and concussion management strategies, things that we can do to help increase an athlete return from a concussion faster. So without further ado, let me flip this around and let's get to it. Bear with me here. Alrighty. I'm going to be talking about the effects of progressive muscle relaxation and therapeutic coloring in concussion management. Little background, concussions are really big right now. There's a lot of information about different techniques. CTE is huge, a lot of research coming out in the last couple of years. So concussions are really big because they alter the cardiovascular response, sleep cycles, moods, depression, different psychological functioning. All of this is indicative of activation of the sympathetic nervous system. And that becomes a really important piece here in a second. So the most common concussion management strategy that we have is the sit and wait approach. And that's after an athlete suffers a concussion, they go and they sit back to their dorm, back to the room, at home, whatever it is, but limit the stress that's placed on the brain. No homework, no TV, no cell phone, no music, just sit there, rest, relax, let your brain recover. Evidence has been coming out now that sit and wait is not good enough. You're having an athlete whose complete identity has been caught up in them being an athlete, and all they know is to be active, and now you're telling them to just sit and do nothing for days on days on days, and it's really having a negative effect. Provence, Engelman, Turin, and Coles even indicated that it causes depression in the athlete, which really hinders the rehab process. So coincidentally, we've got researchers such as Howell et al., who are studying using mild aerobic exercise as an effective management technique. The mild aerobic exercise doesn't aggravate the symptoms of the athlete, and it activates the parasympathetic nervous system. So it dominates over the sympathetic. It flips off the sympathetic drive, which is hiking up the cardiovascular response, hiking up the chemical imbalance, and the altered psychological functioning, and it's turning that off. It's activating the parasympathetic, which lowers the cardiovascular response, which helps align chemical balance again, as well as steadying the psychological state. So we've got some promise with some aerobic exercise. Coincidentally, when we look at stress activates the sympathetic nervous system in a similar fashion as concussions do. You get the increase in blood pressure and heart rate. You get the increase in cortisol levels. You get the altered psychological functioning as well. So there's a lot of research behind the effectiveness of stress relieving techniques and how stress relieving techniques do great at relieving stress in the body, but we don't really have a marriage of the two yet. We haven't seen any research focused on using stress relieving techniques to manage concussions. So really no comparison there, and that's the gap that my research is going to fill. So my purpose statement of this study is to determine if progressive muscle relaxation, or PMR, with therapeutic coloring can return a collegiate athlete to neurocognitive baseline faster than with rest alone. Leads us to our research question of how much faster did a collegiate athlete's neurocognitive testing scores return to baseline when compared to rest. Our null hypothesis is that there's going to be no statistical difference in duration it takes to return the athlete to neurocognitive baseline. Let's talk a little bit about PMR and therapeutic coloring. Okay, so PMR requires that the athlete goes into a quiet space, closes their eyes, and then contracts different muscles to identify where tension is being held and then specifically relax those tension areas. Therapeutic coloring is one that's been a lot more popular. Mandala coloring is the most popular, but the athlete gets into a quiet space and starts coloring in the patterns. The coloring helps activate the parasympathetic nervous system, decreasing heart rate and relaxing muscle tension as well. So those are the two techniques that I studied on. Did use a random group study. When after suffering a concussion, each athlete was assigned to either a control group or a treatment group. We used 30 students from an NAIA Division I university. Instruments used the impact testing for baseline scores and for subsequent neurological testing. Also used Excel to help keep track of all the data. So when participants came onto campus at the beginning of the year, they were educated about a concussion. After the traditional education period, they were then given a consent form saying that the medical staff at the university were conducting research regarding concussions, and asked if, in the event that they suffered a concussion, if they could be used for the research. After receiving consent, athletes completed their baseline impact test scores that were going to be used throughout the year. When a blow was suffered, the athlete was diagnosed by an athletic trainer and then confirmed by a medical doctor, then randomly assigned to either a treatment group or a control group. The control group was the sit and wait approach, where they were just to completely rest, no external stimulus. The treatment group received 1 PMR and 1 therapeutic coloring session a day with our team's sports psychologist, and then in addition to their normal sit and wait and rest. Each day, an athlete symptom checklist was monitored by an athletic trainer, and once all symptoms were alleviated, were at 0, athletes were impact tested again to see if those neurocognitive scores had come back up to baseline. If the scores had not come up to baseline, the athlete received treatment for a whole nother day, and then the following day were impact tested again. I did conduct an independent t-test on the means at a degrees of freedom of 29, which is n-1, and our significance was measured at p is less than 0.05. Our results yielded that the treatment group did have a lesser mean and standard deviation, giving us a p of 0.021, which means we reject the null hypothesis, accepting the alternate hypothesis, saying that there is a significant difference, statistical difference, between the scores here, saying that our treatment group, PMR and therapeutic coloring, did return an athlete back to baseline faster than with rest alone. So what does this mean? Well, this literature is the first of its kind. Like I said, this is the first literature that really molded stress relieving techniques with concussion management. But the key is around the sympathetic parasympathetic nervous system. A concussion activates that sympathetic drive and has a high sympathetic dominance over the body. The faster that we can activate the parasympathetic nervous system, the faster we can alleviate those symptoms. Okay, we've got lots of research regarding how light aerobic exercise can activate that parasympathetic nervous system faster than with rest alone, and can help an athlete recover from their concussion faster. Sympathetic activation really counteracts most of all of the symptoms that we see with a concussion. We get a decreased heart rate, we correct the chemical balance that's going on in the brain, we can steady the psychological state so we don't get the mood swings, much, much faster than we can with a sit and wait approach. I would highly recommend to you guys that using PMR and therapeutic coloring could be a very beneficial strategy in concussion management. This could be used in your clinic to help your athletes recover from concussion much faster. Both techniques are very simple to do. Once an athlete understands how to do them, the athletes can actually do them themselves. They don't necessarily need someone to assist them through it. But it's all about how fast can we activate that parasympathetic nervous system. All the research points to a faster activation of the parasympathetic yields faster results than with rest alone. We do need to look at other strategies and see if other strategies are going to be effective, such as other stress relieving techniques. I only highlighted on PMR and therapeutic coloring, but there are many, many, many different stress relieving techniques that can be used and have proven to activate the parasympathetic nervous system when completed. Guided imagery is one that comes off the head. Yoga is another one. So testing to see if those techniques are as effective as PMR and therapeutic color need to be analyzed, and then in what combination yields the best results. I mean, maybe PMR and yoga is more effective than PMR and therapeutic coloring. We need more research to determine if that's actually valid. Also, we need to analyze and see if using stress relieving techniques in concordance with light aerobic exercise yields an even faster result than just with stress relieving techniques alone. My research indicates that stress relieving techniques work for concussion management. Howell has looked at how light aerobic exercise helps with concussion management. So let's marry the two and let's see if that yields even faster response for the body. Here's some of the references that I've used for my research. Now let's get to our questions. I just want to know what did you guys learn? Was there anything new that you guys learned, and then how could you incorporate directly into your practice right now? What stress relieving techniques, in your opinion, do you think you'd be curious to try to attempt the effectiveness? Like I said, there's numerous different stress relieving techniques, and each of them could provide a different benefit. We don't know, but which ones would you be curious in trying out? And then finally, how as we as clinicians can get an athlete to strongly adhere to a new concussion rehabilitation technique. Some of these things can be a little funky, like when you're talking about guided imagery and you're asking an athlete to close their eyes and picture that they're in a field, walking through a field, and now you see a waterfall. You know, athletes could really just not adhere to the stress relieving technique, and that could really affect the how well the stress relieving technique works. So what are some things that we could do to get strong adherence from the athletes? Let me flip this around one more time. So give me a second. Thank you for listening. Once again, the research just sits around the sympathetic and the parasympathetic drive. If we can hinder the sympathetic nervous system and by activating the parasympathetic nervous system, then we can really have a benefit in getting the athlete to return to their baseline faster than rest alone. Hope you guys learned something. Hope you enjoyed it. Really excited to see your comments and to dialogue with you guys and just talk with you more. Hope you have a good day. Thanks for listening.